From a very small brick building that sat at the top of a hill many years ago, it's developed into a full-service hospital, but has never really lost its personal touch as far as patients are concerned.
What has stayed the same is the Methodist commitment to their patient, the Methodist commitment to outstanding health care.
It is very, very visible that the staff of this organization deeply care about their quality they deliver, they care about patients, and they also care about Methodists.
They go above and beyond their job descriptions to really make sure everybody has the best experience that they can.
What makes me most proud is that we really try to be person-centered and patient-centered, and to remember that we're taking care of a person, we're not just taking care of a number. And I think we've done that from top to bottom.
If you go back to our founding in 1900, that's probably the one thing we've never lost, is the caring and commitment, and it's something that we're very proud of.
By the end of the 19th century, the growing population of Peoria, Illinois was in desperate need of a new hospital. To meet this need, deaconesses of the Methodist Episcopal Church went to work, and in May of 1900 opened Deaconess Home and Hospital, along with the School of Nursing on Glen Oak Avenue. By 1917, the newly renamed Methodist Hospital was caring for more than 1,000 patients a year and educating a growing number of nurses.
When you look at our School of Nursing and Methodist, it's been one of the strengths of Methodist for 110 years. As part of the reason why we have great nursing. We were built with great nursing in mind.
Methodist would be a far different institution without having the medical school, the nursing school, and the residency programs.
Any type of educational program is to the advantage of the patients. Faculty has to be on their toes to be able to provide the answers or find the answers, and the patient is benefiting from what's really cutting-edge thinking and technology.
We've created a strong education system for nursing and a strong support system for nursing at the hospital.
And that's the one thing that makes Methodist special, is that consistency from year to year, from generation to generation in our nursing. And now as a nurse magnet hospital, we've been recognized by organizations across the country for our outstanding nursing.
It just simply says that this organization is deeply committed, first to patient care and to the environment that allows nursing and other caregivers to do their very, very best in providing quality and safe care.
In fact, I'm very proud to say that U.S. News & World Report listed our nursing 6th best in the United States. So I think that says almost all you need to know about how great our nursing is.
Throughout the 1920s and 30s, Methodist continued to grow, increasing capacity to more than 200 beds. The hospital also began to gain recognition for innovative patient care, thanks to the leadership of its physicians. Early innovations include pioneering use of radium to treat cancer patients, one of the nation's first schools of X-ray technology, one of only 31 specialized cardiac clinics in the country, and the acquisition of a mechanical kidney, one of only 4 in the country.
Innovation and being on that leading edge is just part of the history of Methodist. In 1954, we put in the first mental health unit, and today we're still the only inpatient mental health provider in this region. We did the first open heart in this area. We had the first PET scan. We had the first cobalt treatment. We did the first imaging and oncology studies.
Innovation is driven by the physician. It's not the other way around. And Methodist was very successful at recruiting high-quality subspecialty physicians throughout the 70s and 80s.
In 1970, Methodist opened Peoria's first cancer care unit, a state-of-the-art radiation oncology center.
And for many years, the only radiation therapy in Peoria was done here at Methodist. And Methodist took part in perfecting that as a service and making it a mainstay for cancer therapy.
In 1975, Methodist performed their first open-heart surgery, marking the beginning of the area's longest-running open-heart program. Methodist physicians also performed the area's first cardiac catheterization procedure under the area's first cardiologist.
Dr. Susan Shea came to Methodist and aided with the insertion of the first temporary pacemaker that was done in Peoria. And by his effort, the first coronary bypass graft surgery done in Peoria was done here at Methodist.
The Heart Care program at Methodist twice earned recognition as one of America's top 100 hospitals for cardiovascular services. Methodist was also the first to offer a safer and less invasive procedure for abdominal aortic aneurysms, putting Methodist at the forefront of treating life-threatening vascular disease. Other innovative physicians include Dr. C. Dwayne Morgan, founder of the Methodist Sleep Lab, one of the nation's first, and nationally recognized anesthesiologist Dr. Bernard Wetzler.
It was under his leadership that the ambulatory surgery unit was developed, which is one of the first in the area. It was so unique that it went on to achieve a national reputation, and he himself had a national reputation.
Since then, Methodist has continued to explore new ways to make healthcare easier and less invasive, like offering robotic surgery, which requires smaller incisions and speeds recovery. Other Methodist firsts include the state's first mobile mammography unit, becoming the first area hospital to offer CT, PET, and MRI technologies, and pioneering the use of electronic medical records and computerized order entry by physicians. Methodist also added a fully accredited Center for Wound Care and Hyperbaric Medicine. Methodist introduced the Wellmobile to bring free or low-cost screenings and wellness education to dozens of area communities, and launched in-school health clinics to help children stay healthy and in school. These advancements in treatment and the outstanding care provided by our employees make it clear why Methodist has been recognized as one of the top hospitals in the United States.
At the end of the day, we wouldn't be where we are without a wonderful, dedicated, engaged, and caring staff that make the difference every patient, every day. That's what makes Methodist special.
Throughout the latter half of the 20th century, Methodist continued to grow and expand its capacity to care for patients, a trend that is illustrated today by the North Allen Road facility and the hospital's downtown campus.
In addition to the new entrance at Methodist, we are constantly upgrading the patient rooms and the waiting areas. Part of that's driven by new technology.
Methodist has really been well ahead of the curve to improve our patient care and to improve our outcomes. We believe that we're in the top 5% of hospitals nationwide when it comes to information technology.
We have the latest in electronic check-in devices to make your visit here very quick and simple. You can go on to our website and learn a lot about what might help you be a healthier person.
I'm excited about our patient portal. Patients can log on and maintain their own personal health record, keep track of their medicines, their diagnoses, and they can use that portal to communicate with their physician. They can request an appointment in my office. They can even do an electronic visit with me for something like a sinus infection. Oftentimes we can take care of that problem without requiring an office visit, which is a great convenience for our patients.
What's exciting about the next era of healthcare is for the first time, because of technology, we are now at a point where we can actually start doing things to keep people healthy.
Like promoting good nutrition and good exercise.
To being able to monitor blood pressure, cholesterol.
Do excellent primary care, to do preventative health things well, and hopefully patients don't need to be in the hospital as much.
The world of tomorrow is going to be a whole new focus, a paradigm shift. It may sound simple, but for those of us who've been in healthcare, we're talking about something that is just so dramatically different than what we're used to. We're talking about being partners and helping you stay healthy, and we're going to give you the tools. We're going to work with you to create this happier, healthier quality of life and hopefully help you live longer.
Well, I think what excites me the most is that Methodist is really positioned very well for what is going to happen with healthcare in the new era of reform. We have not just a hospital, but a very strong integrated system. We have a very strong physician group. We have a college of nursing. We have a home care service with hospice. We have many outpatient clinics, specialty services.
Methodist offers all the services that most families are going to need in order to stay healthy or get get better.
There are good reasons to come to Methodist.
The first 110 years of Methodist Medical Center have been filled with dramatic improvements in healthcare. But our most exciting years are ahead of us. Methodist is poised to deliver a level of healthcare that has never existed in this area, becoming wellness partners with our patients, giving you the tools, technologies, and care you need to have happier, healthier, and longer lives. That's Methodist. We're taking you well into the future.